We are getting back together after almost a month. I have been off the air for almost 3 weeks now, and it's due to the holidays. I was a little sick, and I think you guys will relate that we've had so many people that have been sick that it's been unprecedented. So we were not expecting that. But believe it or not, we are having a real COVID spike. But this time, even though the spike in COVID is not as bad as it's been, back in 2020 and 2021, but we've been getting a lot of cases of COVID, flu, type A and type B, and RSV. So it's a combination of multiple viruses, and everybody around me seems to be sick. We've had an increase in patients coming to the office. We've had an increase in patients being hospitalized, and unfortunately, we've had some deaths reported, even though the number is rather small, but enough to raise a slight alarm. Uh, Hospitals and medical institutions have gone back to reinstating the masking policy, and we are required to mask up, even though it's mandatory in the hospitals. In the office settings, it's still optional, but given the number of cases that we've seen over the last 2 or 3 weeks, it's been incredible. So the bottom line is, please mask up if you can. Most of you, I can just honestly say, probably are sick or have been sick. We've had everybody in my office get sick over the last about 2 to 3 weeks, and sometimes recently, interesting fact is we've had some people get sick twice. They got sick, they got better a week later, and a few days later they were sick again. So there is definitely increased viral activity. Symptoms are more like cold symptoms, but the cough has been bothering everybody a lot more. So with the cough, what has happened is we've had cases of developing from cough, congestion, the usual cold-like symptoms, to a cough that's getting worse, people having chest tightness, chest congestion, productive cough, which means they're bringing up phlegm. And a lot of patients mention that they feel like they need to bring it up, but they can't. And when you listen to the lungs, I've seen a lot of patients with wheezing. A lot of them who usually do not have any history of asthma or COPD, but they've been suffering from that. So that is rather significant finding, and it's unfortunate because we've done a lot of x-rays. I usually don't order x-rays at the drop of a hat, but we've had to order more x-rays, and we've diagnosed some people with pneumonia as well. Old people, yes, but even some young people this has been hitting them hard. So just watch out. What are we doing? What should you do? One is wear a mask if you can. Try to avoid big parties. Now that most of the parties are over, Christmas, New Year's, it's over. And now everybody's already sick, but see what you can do about that. Medications, over-the-counter medications still are helping. In fact, the prescription medications, a lot of them are actually out of stock. The cough medicines, which we commonly prescribe, have been out of stock, and they're in back order for like 3 weeks. What's the point? But that's what we've seen, and I've never seen cough medicines go out of stock. So we've been prescribing Mucinex DM, Corcidin, Coricidin, and your Dayquil and NyQuil, Theraflu. Those are the medications that are fine. They are basically symptomatic treatment for your coughs and colds. They'll get you through this. So if if you don't have any contraindication, like if your doctor has told you not to particularly take those medications, I think it would be reasonable to start taking those. They'll get you through this. Take Tylenol 2 or 3 times a day for 3 or 4 days. That should help. And then obviously see your doctor, because it is presenting in a very mild way to actually rather sick, where we're trying to avoid hospitalizations. So these are the things to keep in mind. Seems like the COVID vaccine is not as effective with this new strain. But again, the COVID vaccine is always touted as it prevents hospitalizations. It does not prevent you from getting COVID. So it's a glass half full, glass half empty kind of situation. So I don't know what to tell you, but flu vaccine, most of the flu cases that I've seen have been patients who did not get vaccinated this year. Not trying to say that the flu vaccine would have saved you from getting it, but so far, from the cases that I've seen, people who got the flu vaccine did not catch the flu, or they probably caught it and they didn't test because it was mild. Either way, is something to keep in mind. Please post any questions that you might have. I'm sure there's enough people who are sick and dealing with this. So the other thing that has helped us is, and I still struggle with this, what to do, is testing for COVID and RSV and flu. Simple answer is yes, it's a good idea. It's called a fourplex test. Fourplex. So it's checking for COVID, flu A, flu B, influenza A, influenza B, and RSV. I've seen all of these cases, and in one particular case, we got someone who tested positive for COVID and flu. I don't recall if it was A or B, but both of the viruses were active in that person, and the person was pretty sick. Fortunately, did not get hospitalized. Medications that we prescribed kind of helped. So fourplex test. Why am I a little conflicted about it? It's still an expensive test, $100 to $150, I think. Labs are more than happy and excited to do it, but and it's definitely much more accurate than your home COVID test. But is it really worth $150? Because if it goes into your deductible, then you're paying for that test too. So do a home COVID test. It's cheaper, quicker. If it's positive, then it's definitely positive. If it's negative, then it can be a false negative. But depending on the symptoms, depending on your insurance, depending on your deductible, and how soon do you get that test from getting sick? If you were sick 2 days ago, the test might still be worth doing. But if you have been sick for 10 days now, whether you test positive or negative for any of these, I don't think it's going to make much of a difference. It's more, at this point, it becomes management of the symptoms. So keep that in mind. I'm not telling you not to do this test, but it's always reasonable to look into how is it really going to help, and is it really going to change your management. Done earlier on, yes. If you test positive for COVID, we can prescribe Paxlovid. And if you test positive for flu, there's Tamiflu and Xofluza. So there are a couple of medications, and it might be worth taking those earlier on to reduce the complications and how this works. So that's my take on this. Obviously, everybody's sick. I was sick, and my other providers, all the people in my office were sick. Fortunately, everybody has recovered, and we're trying to do our best. Still, almost one person in my office has remained sick for the past 2 weeks. So just to keep in mind. a lot of people now, even after they're recovering, they're complaining of fatigue, feeling very tired, no energy and weakness. But fortunately, everything else has improved. So the fatigue, and I think it's basically that this sickness is taking, more than 3 or 4 days to get better. Like people have been sick for 10 days to 2 weeks. And if you stay sick like that for 10 to 14 days, it will take you a month to recover. So once if and when you're able to resume your normal diet, normal activity, you're eating and drinking fluids, water. If you're able to eat and drink as normally, then you should regain your strength and energy soon. Yes, I know a lot of people are very scared and worried about that. But the good news is that people who've been sick before Christmas seem to have returned to baseline now. But people have been getting sick over the last 10-15 days. They are still struggling with this. Bottom line, keep in mind that COVID, flu, and RSV are active, and the regular cold also active. So we just have more viruses in the mix. Number two, people are getting a little sicker than usual than the previous wave. So keep a lower threshold to take medicines or go to the doctor. The home remedies perfectly fine, but keep a lower threshold, and then be patient. It's going to take more than 2 weeks for you to kind of recover, whether it's from the cough and other symptoms. Some patients have reported loss of taste and smell, which we began to associate with COVID, but in the combination of everything, and if your nose is all clogged and congested, you're not going to taste anything that way either. So again, the fourplex test has shown reasonable results, so something to consider if it's earlier on in the illness. Otherwise, if it's past 5 days that you've been sick, I'm not sure how much value you're going to get except for knowing what exactly you have. In some cases, antibiotics are helping people who are smokers or COPD, asthma, where they're just getting very, very sick. You hear wheezing, and the chances of super infection. It's still a virus, but then it tends to, people tend to catch on bacteria, and that can cause further complications. So we are just assessing each patient and treating them accordingly. So go see a doctor if you're sick. Definitely start with your over-the-counter cold medications. They help, they work. The medications that we guys prescribe are just a stronger version of those things. So you can start taking those, and Tylenol is good 2 to 3 times a day for at least 3 days. Whether you have a fever or not, it'll help you with the body aches, etc. So that's my spiel on the viruses that have been highly rampant over the last 3 to 4 weeks now. Secondly, another issue that lately we've been encountering for our Medicare patients are now this is a completely different topic. Guys, if you have any questions about what I just said, please post that over there. I'll definitely, I would like to answer them, especially if if any particular friend or family member is sick, and if you have any questions regarding that, I'm more than happy to answer that. So I came across a few cases over the last 2 or 3 months that Medicare has been denying lab test results for a lot of patients, and I think it's their Medicare Advantage plans. They have something to do with this. So I dug deeper into that. We usually people are complaining about fatigue, feeling tired a lot, and a lot of times what we encounter is B12 deficiency, vitamin D deficiency, and also we check for diabetes, hemoglobin A1C. So lately, we've been getting denials. The patients have been getting denials for these tests that Medicare doesn't cover that anymore. The unfortunate truth is that these tests, hemoglobin A1C, not so much because it's for diabetes, but the test for vitamin D, magnesium levels, and B12. These are surprisingly very expensive, and I looked at what these labs are charging for these tests is ridiculous. So we have obviously really cut down, but just in case if your doctor is ordering these tests, you want to run it by your doctor that do I need these tests or can we do them less frequently? I have changed my method of ordering tests to fewer tests because even though it's helpful, sometimes it helps you diagnose patients with these conditions and you get them better, but patients do feel better, but now they get this bill for like $300-400. Then suddenly they don't feel better. They don't feel as good anymore. So I don't think it's unreasonable to order for those things and test for those things, but it's also unreasonable for the labs to charge the amount of money that they're charging, and for Medicare to just not pay for that. And what they do is stick you before you go for your test, and then your lab tells you that these tests, some of the tests are not covered, so you have to sign that form. One is, I would tell you, don't sign any of those forms. You can always check with your insurance what is covered, what's not covered. You can shoot your doctor an email or go talk to them and see if it's really necessary. It's important, and your doctor might feel that it's necessary, but is it worth it at that point? And if it's really going to make a big difference in how your doctor is going to manage you or your condition or your symptoms, then I guess it might be worth it. But again, we are changing our methods of ordering tests and trying to cut down on that. Not because I don't think it's necessary, but again, how much worth it is. If it was a cheaper test, I would still continue to test everybody. But the insurances started putting that on the patients, and I don't think that's fair. So we're gonna have to work around these things. But you should be aware. Tests like magnesium, vitamin D, B12 levels, folic acid levels, and some other smaller unusual tests. But we're used to hearing, and our patients are used to telling me or requesting, oh, just test me for everything, just check everything, just be cautious. If your allowance or your health plan covers all that, you have an FSA to cover your deductibles and things like that, then by all means, these are tests that these are almost like screening tests. Sometimes they hold the answer. If we diagnose someone with vitamin D deficiency, we treat them with vitamin D, they do get better. Same thing with B12 and magnesium, etc. But I don't quite understand where this is. So check with your doctor, check with your insurance company, so that you don't get hit with these big bills. It's not easy always, even for the doctors, to kind of appeal on your behalf, and it gets very tricky. So something to watch out for. So this lady, asked me that, hey, my hemoglobin is slightly low and my vitamin D is slightly low, and I recently recovered from COVID. and I've been sick. My husband's been sick, so but now I feel so tired, exhausted, and everything. Do you think it's because of this, or is it my slightly low hemoglobin, or this and that? So she asked a very specific, very clear question, and she trusts me, so I was able to just clearly, honestly respond that I don't believe any of her blood work is causing her to feel tired. It's probably because of the how sick she's been over the last few weeks, and it's probably that, and it should she should improve and feel better. That was a very nice interaction, and I hope you guys can always ask your doctor, and then see what response you get. Not necessarily to argue or question, but it's always fair to just ask how you feel. That is it. Could this be responsible? I said no, and then she was like, "Okay, great. So I'll continue to take my vitamins and eat better and be patient." Now I come to the PSA test. It's called the prostate specific antigen. It's a test to screen for prostate cancer, not for prostate problems per se. A person can have prostate cancer, no problems whatsoever, and have all sorts of prostate problems and not have prostate cancer. So the PSA usually is a marker for prostate cancer. Doesn't always mean that if it's high, person will get diagnosed with prostate cancer, but if it's very high, most likely the patient has prostate cancer. I've had like one or two patients where the prostate level has been very high, and all the biopsies and all the workup has been negative. But for the most part, the idea to check a PSA is to screen for prostate cancer. So we used to order that. We used to order the PSA rather frequently back in the day, and then some guidelines came out saying do not order the PSA test for the patients. And then there was some guidelines that if you are, and then they came back with Mr. Patel, hi, and then they came back with that okay, you can check the PSA, but discuss that with the patient. What you're going to do about that if it comes back positive, because they were worried about false positive. That means if the PSA is high but there's no prostate cancer, or they didn't get diagnosed with prostate cancer but the patient had to undergo the stress of believing that they have cancer, and the stress of going through the biopsies and everything, and we still have that. Some patients, we do that test, it comes back positive. It's a terrible feeling to feel that you're diagnosed with cancer, because everybody will Google that, and then the Google will tell you that, oh, you probably have prostate cancer. So the take on, and then so it was do it on everyone, then it was like don't do it on anyone, then it was like do it when you feel it's appropriate and discuss it with the patient, and then so now where my take on this is that I check the PSA level on patients every 2 years after the age of 50 to 55, and it's almost like a screening test, because I think that in my practice we have a good relationship with the local specialists, and we're able to communicate on the patient's behalf. Sometimes it's very difficult for the patient to make a decision what's best. So as their doctors, we have to take responsibility, as this is someone in our family. So what would you do? So sometimes it's reasonable to check a PSA level, just like you do a breast mammogram for women and colonoscopy. So doing the PSA, yes, 1 in 10 people will end up having a biopsy that'll come back negative, but more frequently 7 to 9% we've had people who tested positive for prostate cancer. So and then so are the urologists in the area. They're also checking the PSA. That means that we are ordering the PSA, I do it separately once every couple of years in my older patients. And I stop checking that when they're older, like 70, 75 plus, because at that point, it's not going to make that much of a difference by screening and checking for that. But in this middle range, I think most of my patients have been very receptive to taking the risk, like, let's find out, and if I have, or if I'm in doubt, I'll go get the biopsy. And so it's almost my patients have wanted me to check it, and I think it's quite reasonable. Does it have to be ordered separately? Yes. And how much it costs, I don't know, but I don't believe it's a very, very expensive test. So more of the question, Ken, is keeping an eye on the PSA levels once or twice a year. Twice a year should be fine. And at that point, I think it's covered. I've not had anybody come back and say that, oh, my PSA test got denied. My insurance did not pay for that. Again, keep in mind what your deductibles are, because even if it's covered, it can fall into your deductible. But that's a whole different issue. So always good to check with your insurance. It's a pain in the butt. It takes time. But believe me, honestly, your doctors do not know how much these tests cost. Will they be covered or not covered? There's like 10 different insurances, and then they have 10 different plans each. So dealing with 100 plans, and each plan is designed to, screw you in one way or another. So there's no correct answer. Just ask questions, and if in doubt, call your insurance, clarify before you go, and this will help reduce your anxiety and cost. So going back to my cases of COVID, flu, and RSV infections, a lot of people. So if you're an asthmatic, or if you have COPD, or if you have other lung issues where you've ever needed to use an inhaler, an asthma pump like medicine, or like a disc that you inhale through, you please, if you're feeling you wheezing and your cough is, you get yourself checked out, because there's a good chance that you might be wheezing, and you might need to refill, renew, or resume using those inhalers, maybe even for a short time, but something that I've been seeing. Heart failure patients, please be careful with falling sick with these things, and travel. Recently, if you've been traveling, please be aware that congestive heart failure can get worse, whether it's travel related, plane related, or you just got sick and then your congestive heart failure symptoms got worse. So it's all out there, it's all possible. Have a low threshold to get checked out around this time. Once it settles down, then it's fine. If you have persistent AFib, how do you feel about a pacemaker where they cut the connection between the top of the heart and bottom? So what you're talking about is basically ablation procedures. That so atrial fibrillation is where people have an irregular heartbeat. So instead of heart beating like it starts beating irregular, it's not even musical, it's just off. But what's the big deal with that? It can make you dizzy, lightheaded, and when the heart is not beating regularly, you can form clots in the heart, which can shoot up to the brain and cause a stroke. So it's very important to treat that, and it's a very important condition. Apple Watch can catch that. But that's a different thing. But so part of the treatments of atrial fibrillation have been to control the rhythm, to slow down the heart, and make the blood thinner. So even if the thinner the blood, the less the chances of making clots. It's almost like beating an egg or something. That when you do that, the lumps and the clumps that can form. So if the blood is thinner, you're less likely to form clots and less likely to throw one into your brain and cause a stroke. And then newer technology has allowed doctors to basically go into the electrical system of the heart, and basically they'll disconnect certain electrical circuits that are causing these, and uh, and then they can basically put a pacemaker in, and then let that regulate the heartbeat as opposed to naturally what's going wrong. For the persistent AFib, yes, if you've had it for very long, and if they feel, obviously after checking and looking at the heart and all, the echocardiograms and other studies, so they would have recommended some newer forms of where they feel that they can get you off of the blood thinners maybe, and just help you figure this out, because if you have other medical problems, then this will be one less, and likely more likely to work, because if nothing else is working, despite the medications of the blood thinners. But the medication of the blood thinners keep you from having a stroke, not necessarily fix the atrial fibrillation itself. So, and again, like I don't mind. In fact, I enjoy doing this every week. I love to share, anything interesting that I've seen in the office. I like to share some interesting cases that I see. Obviously, some cases can be a little bit too intimate to discuss without giving a more of a perspective. But some cases that have been very touching lately have been about alcohol addiction, and how it's affecting families and people close to them, and what how we have dealt with those and helped the patients with that. So be aware of that. And anxiety and depression are big. One of the recent cases that was really touching was well, I'll tell you about that. I have medical students. I teach for a couple of medical colleges, so there's always students, and they always have inquisitive minds. And they'll ask questions why we do certain things, how we do. So it's always a teaching mode that I have. So I don't mind answering more questions to people. So definitely don't hesitate to ask. I know a lot of people watch this, but then they hesitate to ask the questions. The whole point of this is I'm not making fancy videos and trying to educate. This like 50 million on YouTube, but I'd rather just answer your questions as much as I can, and I'm sure other people can see that. So I'll end it with a very touching case that I had 3 days ago, I think, and we ended up having a long discussion with our students after that. Had a young couple come in, and we were just talking about this young lady, about 30 years old or maybe 35, having these headaches that are bothersome. She was also sick with something, with one of these viruses 3 weeks ago. Now the headaches are not going away, and she's feeling tired, and wanted to get blood work done, let her check everything. Husband was there. Everybody seemed a little concerned that why is this going on. And obviously we looked at the blood work, we looked at the cholesterol levels, we looked at the thyroid levels, because that's a common one. And yet things were not fitting. And we asked, like, so what else is going on? And then she shared that actually both of them shared that they had about 6 months ago, about 6-7 months ago, they had undergone an abortion. They already have 2 children, and they had this pregnancy, and hesitantly they said unwanted pregnancy. And then both husband and wife had agreed to proceed with an abortion. It was only 5 weeks, but they still ended up doing a DNC. So that means medically evacuation of the fetus, and not with a pill. Whatever the reason might have been, up to them. And then, both everybody was in agreement, everything is fine. But 7 months later, I think the mother could not really get to terms with that. And we understand that, it's nature. Whenever someone goes through a situation like that, it's not that simple. Whether you terminate the pregnancy by choice or not by choice, it's not a good feeling for the woman naturally. It's something that nature has created, and when it goes, it doesn't go sit well. We sat down and talked about that, and I think once we opened those gates, with the husband and the wife, yes, we ended up sitting for another 30 minutes. I was behind by an hour and a half that day, but I think they did not realize that this was one of the biggest problems that was underlying, that the mother just could not somehow subconsciously get over that. And this is just one example of how people are dealing with anxiety and other things like grief, loss of a loved one. People lost a lot of family in the last 2 or 3 years because of COVID and other things. So these things are very hard. What's my point in telling you all this is it's okay to share. Bring it up to your doctor. And sometimes we can refer you to see a therapist. Sometimes we can give you some insight into these things. But the feelings of anxiety, feeling of a knot sitting right here, depending on whether it's good things happening or bad things happening in your life, but this anxiety and dealing with prolonged grief, these are the things that your doctors can address. And do not hesitate, because not all of us will always have the time or the insight to go ahead and ask that question and open those gates, because sometimes there's no time, but I think there's always some time. So do not hesitate to share these things with your doctors. A lot of times it can help you a lot more than you think. There you go. It was such a case that had we not opened those gates, we would never have figured out why this person was having the headaches and why Tylenol was not helping. So, guys, if you want me to keep doing this, please post your questions even before, because I know not everybody can watch at the time when I go on. Everybody's got a life. But if on my page, if you put in the questions, whatever you put in there, I'd be happy to get it all together, get some more evidence-based questions, try to make them more specific to you, and give you my opinion. And you don't have to see me necessarily. I'm not trying to promote my practice, not trying to promote anything. Go see your own doctor, I'm just giving you some tools rather than Google what usually can be done and how it can be helpful for others. Thank you very much. Bye.